Hi, my name is Pepe Rosway, and I'm the occupational therapist. And I'm also a certified lymphedema therapist. And so today I want to talk to you a little bit about edema. So basically with edema, we're just looking at swelling. A lot of times you guys are one of the first ones that sees it because you do the showers, you help with the dressing on these guys. And so if you see swelling primarily in the feet, there could be a couple of things that could be causing that. Some of the reasons we have swelling can be an exacerbation of some heart condition like CHF. It could be a blood clot. It could be something as simple as the chronic venous insufficiency. It also, sometimes we see it with people who've been sitting in the wheelchair for a little bit because it's kind of a dependent edema along with the chronic venous insufficiency. So my recommendation is, first thing, let your manager on your floor know, whether it's the med tech or if your direct person is the DON of the facility. Please let them know. What we do from there is we notify the doctor. We may order some tests. One of the tests is a BNP, so we can rule out that they're not having an exacerbation of some heart condition. We also quite often will order things like an ultrasound to make sure that we don't see anything like blood clots and stuff. Once they're clear of those things, usually we get an order for occupational therapy. That would be me. And I go in and I assess them for the swelling in their leg. A lot of times my treatment protocol is going to include things like exercise, skin care. That's, making sure the skin stays clean, applying lotion. Also, we use a lot of compression, which you'll get more and more familiar with because you'll start seeing it on your residents when you start working with them as far as dressing and showering. You'll see the compression garments on their legs. Some of the other things that I might ask of you is that you elevate your residents' legs during the day so that we can decrease the amount of dependent edema that we see. Sometimes that can be whether they are sitting in a wheelchair, elevating it on a chair or stool, or sometimes just letting them lay down in the bed so that they can also get pressure relief on their bottom. Some of the types of compression that I use, I wanted to show you guys really quick, and probably one of the ones I don't order a bunch here are the traditional compression stockings. You guys I'm sure have seen these along with these kind and TED hose, which are the white ones. This one is an example of one with an open toe on it. And so we use this. I also order some of the types of trouser socks that have compression. They're usually like 8 to maybe 15 millimeters of mercury, which is a very light compression. They look like regular socks. You probably wouldn't even know the difference. Sometimes they'll have a little bit of writing on the top up here that indicates that they're a different kind of compression sock. So sometimes you'll see these. More commonly, what you're going to see here is Tubigrip. So when we first start treating people, a lot of times this is what we use because we can use multiple layers to increase the amount of compression that we use on the leg. It's a light compression. It's 5 millimeters of mercury, but it can go up so as we add more layers to it. But this is probably one of the most common things that you're going to see here with your residents. So one of the things I want to remind you guys of right from the beginning, if you see compression on your resident, they're getting treated for leg edema, does not mean that they cannot have a shower. Just check with us, and on their shower days we can remove the compression, or you can remove it and give them a shower. I usually try to schedule myself on their shower day. So if your resident gets a shower Tuesday, Friday, I usually let you know that, hey, this can all come off. You can give them a shower, and then once you do that, I usually come in later in the day or after the shower time, and I reapply the compression on their legs. So the compression should stay on their legs until their next shower day. The other thing is for you guys to remember, if you get it wet, please notify someone immediately. If for some reason your resident has to keep their compression on, that you can't remove it. Most of the time the reason we would do that is if they have really weepy wounds underneath, then we would ask you not to remove the compression and to leave it on for the shower. So you would just bag the leg or you would do sponge bathing, whichever one you decide as a facility or as a group that you're going to best be able to do. But let's just say hypothetically it gets wet or it gets soiled. Immediately notify either me, notify your DON, notify the med tech, someone on the floor, so that we can get someone in to get it changed. It is going to need to be removed once it gets wet. The other thing is if it gets soiled. Depending on the severity of how dirty it gets, we're in cases are going to need to remove it and then have it reapplied. So that's one of those things. Again, just notify us. Don't just take it off and then leave them until the next treatment time. We would like to come in and get that taken care of. Some of the things that some of the secondary complications of leg edema, and some of you guys have already seen this or you will experience this. Once the leg gets very swollen, it'll start to get little openings in it. You won't even see them a lot of times, but you'll feel the wetness because the leg is only going to expand so much, and then you're going to start seeing fluid come out of those areas, or you're going to feel it when you go to wipe them, or their pants get wet, or their socks are wet, and you're wondering where it's coming from. That's one of those times you want to notify your nurse, the DON, so that we again can contact the doctor and get all the appropriate testing done. Some of the other things, cellulitis. It's that redness. It's an infection of the connective tissue. So you're going to see a lot of redness. The leg's going to be swollen. It's going to look angry. Again, it's another one of those signs that there's some or a secondary complication of the edema. And then also we deal with a lot of wounds, whether it's a stasis ulcer where the skin has expanded and it starts to break down on itself. That's the stasis ulcer. A lot of times what you see as well is that the leg becomes so swollen they easily bump their leg on something, whether it's a wheelchair, piece of furniture or something like that, and they get a traumatic tear. And then a lot of times those skin tears, because the leg is swollen, will start to weep and things like that. So those are just some of the secondary complications, and it's why it's so important for us that if you see any kind of edema in the legs, please let us know immediately, so that, like I said, we can start all the proper steps to identify what's causing the edema and how we can best treat it and manage it for this resident. So what I want to do now is I want to show you an example of a leg with some compression on. I use the Tubigrip because it's the one that you'll most frequently see here. In this case, what I want to emphasize and show to you is that with the compression, we pull it up to the base of the knee, so it's just right below the knee, and then we also put it at the base of the toes. How you can help is that if you ever see it, this is not a good position for it to be in. If you see that, all we need is just to get it pulled right back to the base of the toes. If it is rolled up, and that happens sometimes, we just need you to pull it back down and just put it right back at the base of the toes. You're not going to see this often because I usually use tape at the top and at the base of the toes to keep it from rolling up or sliding down, because what will happen is where there's no compression, you're going to start seeing a lot of edema. You'll see a lot of swelling here, you'll see a lot of swelling. If it's way down here, all of this area without the compression on it is going to swell up. So that's why we ask if you see that, and if you don't feel comfortable doing it, at least let us know, because all of this is going to start, of course, it'll kind of cut into the skin, and then you just get all this additional swelling here, and then when we have all the additional swelling here, we'll start seeing where we'll get weeping, we'll get skin tears, we'll get breakdown in these areas. So we always want to keep this pulled up. And so, like I said, if you see that on your resident, we really need your help to either pull it up or notify us, because you have eyes on them every day and we don't. I want to thank all of you again for listening to my talk about edema, and I appreciate it so much. And my name is Pepe Rosway. If you have any other questions, please feel free to grab me. Doing the lymphedema, the edema, is one of my great passions. It's something that I love doing. I love educating people about it. I love talking about it. And in this kind of setting, we see so much of it. So please feel free to grab me at any time. Let me know how I can be of help to you, and if you're interested in learning more about it. Thank you so much again, and I look forward to meeting all of you as you're working at the Seasons.